Good evening, everyone. How are you? Hope you're doing good. Today, I'm going to talk about one of the important topic that is malnutrition-related diabetes, officially named as type 5 diabetes. Let's go into this interesting topic. So, malnutrition-related diabetes it is distinct from both type 1 and type 2 diabetes. It has now been officially recognized and named as type 5 diabetes. The vote to endorse the category it took place on April 8 during the International Diabetes Federation World Diabetes Congress held in Bangkok. Malnutrition-related diabetes has historically been vastly underdiagnosed and poorly understood. The IDF's recognition of it as type 5 diabetes is an important step towards raising awareness of a health problem that is so devastating to many people. So let's talk about its history. Malnutrition-related diabetes was first described in Jamaica in 1955. It is seen in most commonly in young men in low and middle income countries who have a BMI of less than 19. They are often misdiagnosed as having type 1 diabetes. The difference is that they don't develop ketonuria or ketosis despite having high blood glucose levels and high insulin requirements. In 1985, the World Health Organization officially classified malnutrition-related diabetes mellitus as a distinct diabetes type. But then in 1999, they dropped this category, citing a lack of evidence that malnutrition or protein deficiency causes diabetes. Hawkins became aware of malnutrition-related diabetes in 2005 while teaching at global health meetings. In 2010, she founded Einstein's Global Diabetes Institute to study it. In 2022, she and her colleagues published findings from the state-of-the-art metabolic testing in 73 Asian Indian men, including 20, which is now called as type 5 diabetes, following the exclusion of all other known forms of diabetes by immunogenetic analysis. So among the findings, they were lower total insulin secretion in the type 5 group comparing to lean group without diabetes and the type 2 diabetes group. And type 5 diabetes mellitus, they significantly have lower endogenous glucose production and significantly higher glucose uptake is present in type 5 diabetes comparing to type 2 diabetes group. Type 5 diabetes group have significantly lower visceral adipose tissue and hepatocellular lipids comparing to type 2 diabetes group. So these findings contradict the previous belief that malnutrition associated diabetes was associated with the insulin resistance. It is not associated with the insulin resistance. Rather than it is associated with, it has a profound defect in the capacity to secrete the insulin. It is associated with the insulin secretion defect, which was not recognized before. The finding has revolutionized how we think about this condition and how we should treat. Hawkins told Medscape Medical News it is important to differentiate this type 5 from type 1 diabetes because if you give too much insulin to type 5 diabetes patients, it can rapidly prove fatal. Although there are not clear guidelines for treating type 5 diabetes, some data suggests that very small amount of insulin combined with oral agents may be the most effective one. And Hawkins added, she suspects that their nutrition should include much higher amount of proteins because they are associated with the malnutrition. So their diet should contain high amount of protein and lower amount of carbohydrates plus attention to deficient micronutrients. But this needs to be carefully studied now that there is a global will and official mandate from the International Diabetes Federation to do so. So there is a working group has been tasked with developing formal diagnostic and therapeutic guidelines for type 5 diabetes over the next 2 years. Thank you so much for your kind attention and kindly share my lecture to your friends.